This program is brought to you by Stanford University. Please visit us at stanford.edu.
Today, our plan is to dig into the ways that innovation can help us break some of these Gordian knots, and not just in the United States, but also across the globe, because we'll spend some time on the developing world and innovation in that aspect as well. To help us, we have a truly distinguished group of leaders and thinkers from healthcare, from business, from government, and from the nonprofit world to help us make sense of this all. Our focus is going to be on the long term, so this will differ a little bit from your typical inside the beltway conversation. We're not concerned about next month or even next year so much as we're concerned about how to move the system in a more constructive way over the longer term, although rest assured we have imported some very able and distinguished Washington insiders, if only to assure anthropological diversity at this conference.
So I want to make a few comments about what I see as the central issue for controlling expenditure growth. That is, sustained reductions in expenditures, and that's going to require some rethinking in which we judge interventions by the value they provide, not simply the health benefit. In other words, look at whether they're delivering value for the money. Now, we happen to have techniques for doing this. This is a major focus of our centers. This is an example of the application of cost-effectiveness analysis.
I'm going to make two basic points. One is that healthcare costs are the key to our fiscal future. And as Alan Garber has already pointed out, there seems to be substantial inefficiencies in the health system. And secondly, that just like economics ignored psychology to its peril for too long, I believe too much of healthcare policy and medical science is making the same mistake.
Genes matter. Patients with cancer, heart disease, rheumatoid arthritis, osteoporosis, and other diseases have individual genetic signatures of their manifestation that now today, because of tools from the Human Genome Project and automated instrumentation, can help determine the best therapy. A stream of molecular diagnostics products or laboratory-developed tests, LDTs, are coming available not only to detect the disease, but to help manage optimally that disease, the individual phenotype of that disease over time. They will provide evidence-based guidelines and information linking the individual genetic variations of that person's disease to medication response profiles. This is the true personalized medicine. So these new molecular diagnostic tests are coming available. They will be priced higher than the way we've traditionally thought of diagnostics. So should tests that will cost $750 to $5,000 be feared by people who want to get a grip on healthcare expenditures, by the medical profession, payers, FDA, and policymakers, or should they be embraced? They should be embraced because they can show excellent healthcare economics.
The preceding program is copyrighted by Stanford University. Please visit us at stanford.edu.